The principal arterial inflow to the brain in humans is via four arteries: two internal carotid arteries and two vertebral arteries. The vertebral arteries unite to form basilar artery. The basilar artery and the carotids form circle of Willis. In human, a relatively small fraction of total arterial flow is carried by the vertebral arteries. The average blood flow rate in brain is about 750 ml per minute of tissue. So this diagram showing the vertebral arteries which are going to join to basilar artery and which are going to give branches to form the circle Willis to the branches of the internal carotid arteries. And the circle of Willis is going to give anterior cerebral artery, middle cerebral artery and posterior cerebral artery, so which is going to perfuse the brain tissue. Some of the features of cerebral circulation. The gray matter consumes very high amount of oxygen. It accounts for only 1% of the total body weight but consumes about 20% of the total oxygen consumed in the body. The total quantity of blood flowing to the brain is remarkably constant. In other circulations of the body, the quantity of blood flow varies sharply due to the factors such as exercise. The brain keeps up its blood supply despite remarkable change in the perfusion pressure, as brain cannot survive anoxic assault. The brain inside a rigid cranial box, except in infants before the closure of anterior frontal. That is, neither the blood nor CSF can be compressed. So if the volume of CSF expands, the brain blood flow has to be reduced, and this is called as Munro-Kelly doctrine. Factors that are going to determine the blood flow, cerebral blood flow. It is determined by perfusion pressure and autoregulation. The brain blood flow will not increase as mean arterial blood pressure increases. Between 60 to about 150 mm of mercury of mean blood pressure, the blood flow is not affected. So this is autoregulation of the brain blood flow. The principal factor in autoregulation is the accumulation of the carbon dioxide. Although myogenic response to decreased distension may also have some role. However, if the systemic blood pressure falls severely below 60 millimeters of mercury, as in severe cardiovascular shock, there is an increased risk of cerebral anoxia. Carbon dioxide concentration. When carbon dioxide concentration of the local brain tissue rises, there is a vasodilatation leading to increased blood flow. Oxygen tension. High oxygen tension in the inspired air produces cerebral vasoconstriction, so that the brain is protected from the dangers of oxygen poisoning. Anesthetics. Majority of the anesthetics reduce brain blood flow, example halothane. They also decrease cerebral metabolism. Sympathetic stimulation produces cerebral vasoconstriction.